Hello, everybody. Reed here. Today, we're going to have an interesting conversation about liver enzymes, ALT, specifically ALT and AST. And for the most part, it's important to review your liver enzymes because the liver is the location where all the metabolism of the medications are happening, all the drugs. Also, you're going to need the liver to metabolize the drugs that are active. And also for prodrugs, you're going to need the liver to create that, metabolize that process in order to release the active metabolite. So it's important to know the function of the liver enzymes. The other day had a liver. Other day had a patient come in with significantly elevated liver enzymes and had to figure out what was going on. Right. So let's see here. Okay, here. Explain the explain a AST. What am I doing? AST and ALT lab. What if each was my words? Lab values and elevated liver enzymes. You busted me out. Horrible typer. You busted me out. Okay, let me see here. Okay. AST, aspartate aminotransferase, right? ALT, alanine aminotransferase. Okay, these are liver enzymes that's measured in blood tests to assess liver function and liver cell injury. When liver cells are damaged or die, these enzymes leak into the bloodstream, causing elevated levels. You got it? When liver cells that are damaged or die, the AST and ALT are leaked into the proteins are leaked into the bloodstream, right? Okay. Here's how to interpret them. The normal range, AST 10 to 40, ALT is 7 to 56. Okay, can value. ALT, alanine aminotransferase, is primarily found in the liver. Now look at this. AST, aspartate aminotransferase, is found in the heart, in the liver, the heart, the muscle, the kidney, and the brain, right? So ALT, alanine aminotransferase, is specifically for the liver. So when you see that elevated, then you know for definitely you've gotten some hepatocellular injury, right? So more specific for injury is when ALT is elevated, it usually means hepatocellular injury, that is damage to the liver cells themselves, right? For example, in the viral hepatitis, right? And the drug-induced damage, fatty liver disease, such as alcoholics and alcoholic steatosis, right? The excessive alcohol intake causes a fat malfunctioning in fat metabolism. As a result, you get a buildup of fatty deposits, causing steatosis and fatty liver disease. Next, so this ALT think is hepatocellular, the liver damaged cell. AST, aspartate aminotransferase, is found in the liver, the heart, the muscle, kidney, and the brain. It's less specific for liver injury. All right, and it can be elevated in muscle damage, myositis trauma, or cardiac myocardial injury. So AST, so when I see an elevated AST, I know there's a major organ system issue, right? It's a major organ system issue. Often elevated alongside ALT and disease. Okay. The AST-ALT ratio, this ratio helps narrow down the cause of enzyme elevation. Okay, less than 1, viral hepatitis or non-alcoholic fatty liver disease. 1 to 1, cirrhosis. 2 to 1, alcoholic liver disease, such as AST is over ALT. 3-1, Wilson's disease or secondary muscle source. Well, okay. Elevated pattern, mild elevations, fatty liver disease, chronic hepatitis, medications, okay, so patterns of elevation, mild elevation that is less than 5 times the normal, fatty liver disease, chronic hepatitis, medications, moderate elevation, 5 to 10, acute viral hepatitis, autoimmune, and severe pattern greater than 10, acute toxic injury, such as acetaminophen overdose, ischemic toxic injury, hepatitis. Yeah. Other liver tests interpret alongside ALT. Yep. See, alkaline phosphatase. Remember biliary injury or obstructions. So remember, in alcoholics, the lipid, the fat metabolism malfunctioning, leading to basically the buildup of bile and increase in alkaline phosphatase. Okay, bilirubin is impaired. Albumins, liver. See, albumin. You have to look at the albumin, because if the liver isn't producing enough now albumin in this, you're not creating enough proteins, right? So that's like fulminant. That's a significant form of failure, liver failure, if your albumin is dropping, because that means that your liver is not producing the proteins. Yep, and then prothrombin time. You would need to produce the proteins and things like that in order to run your clotting factors and things like that. Okay, summary. ALT is specific for the liver, high specificity. Is seen in viral hepatitis, fatty liver, and drugs, because all of these damage the hepatocyte directly. AST is found in the liver, the heart, and muscle, right? Alcoholic liver disease, muscle injuries. If AST is twice the value of ALT, it suggests alcoholic liver disease. All right. I think that's all I wanted to say about those AST, ALT values, and more importantly, how they're used in diagnosis and treatment. So I think that's all I wanted to say about that, guys. Now, next, I'm going to go to I think the other topic I'm going to do next is, let me see here. Okay, well, I'll just show you the next. I'll just do the next one. I'll do the next. So stay tuned for the next one, guys. Take care, guys. Read out. Ciao, guys.